Hello guys, welcome to our channel. In this episode, we will discuss case study samples for the CPC exam. I am the medical coding guy. Hello guys, welcome back to our channel. In today's episode, we will be discussing a couple of case study questions that will help you answering it on your CPC exam. There is a section in the CPC exam which is consist of 10 cases. So this 10 cases consist of multiple choice questions per case that will test your ability to accurately, code medical record documentation using the code set CPT, ICD-10-CM, and HCPCS Level 2. And these cases can come from any code sets from your 10,000 series to your 60,000 series, medicine, anesthesia, radiology, pathology, laboratory, and E&M. So basically anything that you can find in the CPT manual and the ICD-10-CM book and also your HCPCS Level 2 can be asked in these cases. Okay, so again, in some cases as well, there will be some questions about medical terms, anatomy, compliance, and regulatory. So without further ado, let's now proceed with today's discussion. So case study for CPC exam. So what are this CPC case study for your CPC exam? And of course, I will be teaching you a couple of tips and reminders on how you can easily answer these questions. Okay, so your case study questions, as I've said earlier, will be 10 items. Okay, and just to add for this one, it's usually placed at the end of your CPC exam. So what are the things that you need to consider when answering these questions? So of course, as any other types of difficult questions and sometimes easy questions as well, that you have to take time answering these questions, since it's placed in the last section, and it sometimes consists of lengthy scenarios. You have to sometimes answer this if you're done with the easy questions. So that's the way how it works in the CPC exam, right? So answer first the easy questions, then after that you have a lot of time answering the difficult and lengthy questions, because you don't want to happen that you will be answering first the difficult questions and you will run out of time. Remember guys, your exam is going to be 100 items to be answered within 4 hours. Okay, so it is shorter than the previous exam that AAPC has offered, but again, it has only 100 items. So it's mentioned here, take time to answer, of course, usually placed in the last section, and check. You can also check the choices first before you go with the scenario itself, so at least you know what you're going to look for. Let's say, for example, a question is about, let's say, the choices there are your ICD-10-CM. Okay, of course you have to give importance to the diagnosis in the actual scenario. So we'll be answering a couple of cases today. So again, hopefully you will learn something about some techniques that I will be sharing you today. Our first case for today is for female reproductive system. So let's review this operative report, and as you can see, it's a little bit lengthy. So as I've said earlier, you can go directly to your choices and find the question being asked. So it's mentioned here, what's the ICD-10-CM and the CPT code for this scenario? So we will be focusing on those terms in this operative report, so it will be easier that way. So a 37-year-old went and presented to the ER complaining of acute abdominal pain, and according to the doctor, according to the exam and ultrasound, it showed empty uterine cavity, and also the fetus was found where? In the left fallopian tube. Alright, so let's discuss first this female reproductive organs. So as you can see in the screen, you have the major internal female reproductive structures here. You have the uterus, okay, you have the fallopian tube, and you have the ovaries here. Okay, so please take note that a female has one uterus, all right, two fallopian tubes, one for the left and one for the right, and also one ovary for each side, one for the left and one for the right. please take note that the implantation of the fertilized egg, all right, should happen and should be implanted inside the uterus, not inside the fallopian tube, not inside the ovary. Because again, when a zygote is formed, all right, it should travel. Let's say this one is where the sperm and the egg cell meet. It should travel its way for a few days towards the uterine wall, where it should be implanted there, all right, for, of course, for the whole duration of the pregnancy. But again, in some cases, it may get stuck here, all right, or it can be stuck inside the ovary as well. We will call a pregnancy that that got implanted outside the uterus as ectopic pregnancy. So please take note of that. So that is the one we will be locating later, okay? So ectopic pregnancy, please don't forget that. And also the terms that you will use for your uterus, fallopian tube, and also your ovaries. We'll be discussing that a little bit later. So let's return to your question here. The feasibility of what? Ruptured ectopic pregnancy was explained to the patient, and the doctor will do a laparoscopic self-injecting. But first, what is laparoscopic self-injecting? You should know by now, or before you take the exam, for the different terms, different medical terms that they use, not actually giving the exact specific name of the body part. For example, in this case, it's self-injecting. So self-injectomy is what? Removal of the fallopian tube. But let's discuss the three female reproductive structures here and what are the medical terms we will use for the procedures for them, okay? First is your fallopian tube. Okay, for fallopian tubes, I'll just put this one, okay? All right, for fallopian tubes, we'll call the procedure here done as, we will use the prefix salfingo or salfinge. I'll just put salfingo here, okay? So let's say, for example, incision of the fallopian tube, that's self-injotomy. Removal of the fallopian tube, that's going to be self-injecting. And please take note, check if it's left or right. So you might, of course, check as well what's the modifier that you will use, if in case you will be coding for the CPT. As for the ovary, left and right as well, or for the ovaries, we will call it as your OO ferro. All right, it can be oophorectomy, for example, for removal of the ovaries. And for your uterus, guys, it's going to be hystero, right? Don't forget this three medical terms that you will use for these three internal structures of the female reproductive system, okay? It's mentioned right here that the doctor will do laparoscopic self-injecting. That means the doctor will remove the fallopian tube, okay? Laparoscopically done. That means the doctor will use a scope, okay? What else? A live 10-week fetus was found and removed from the pelvic cavity. So it's 10 weeks. Number of weeks of gestation is very important for answering your procedure code, and of course your ICD-10-CM codes for the exam itself. Okay, it's very important. Later on you will find out why. Okay, and removed from the pelvic cavity. And also the doctor noted here that the ectopic pregnancy were found along the ruptured fallopian tube. So it's ruptured as well. So let's check. All right. So how are we going to answer this? Of course, it's either you want to find the ICD-10-CM code first or the CPT. But normally, guys, we should check for the CPT code first. All right. Trust me. It's easier to search for the CPT rather than your ICD-10-CM. But if you have some experience looking for the ICD-10 codes and you're a little bit proficient with that, it's totally fine. It's up to you. Okay. So let's check first the CPT here. Let's compare them. So at least we can eliminate couple of choices here. So you have 58660 and 661 and 661. Let's find those codes right now. So if you have your books, open it. Go to your 58660. So you have 58660 here. That's your laparoscopic surgery. Okay. For what? So it's mentioned right here, self-injolysis and ovariolysis. All right. While your 58661, which is for letter B and C, all right, it's mentioned here that you have self-injectomy in the parenthetical notes. So which one is better to use, self-injulisis or your self-injecting? Since it's mentioned in the scenario, it's self-injectomy, you will choose 58661. Okay, so we can safely eliminate A. Let's say goodbye to letter A now. So we're now left with 3 choices here, which will make your question a little bit easier. So your letter C here, let's check if we will add this 58700. Your 58700 is your self-injectomy. There's nothing mentioned here about laparoscopic approach. So this is an open procedure. So we will not choose this. Although self-injectomy was done, there's no laparoscopic technique here, which is 58661, which is much better to use than your letter C. So you're now left with 2 choices here. So again, let's choose this one. So you have to check now the ICD code. So you have 000.90. We're not yet done because B and D shows the same CPT codes. You have your 000.90 and 0.102. So let's go to your tabular list and find out. Your 000.102 is your left tubal pregnancy without intrauterine pregnancy. So let's underline this. While your other one, okay, this one, 000.90 is your unspecified ectopic pregnancy. Okay, so let's compare both of them. It's mentioned here left tubal pregnancy, and according to the scenario here, the fetus was found in the left fallopian tube. So basically we'll be choosing that tubal pregnancy, all right, in this scenario, and not the unspecified version. So also, if you will check the last code here, if you will go to Z3A.00, all right, that's going to be your, you can answer letter D for now, but again, if you want to check for all the choices and all the codes, just to make sure you of course you are sure with your answer, okay, or to give you more confidence in choosing that letter D, you can also check the last code here. But in some cases, you can go ahead and choose letter D directly, okay, if ever that you're confident in that answer. So you have weeks of gestation not specified. While it's mentioned here, it's for 10 weeks. Live 10-week fetus was found. So according to the doctor, it's 10 weeks gestation already. We will choose Z3A.10 here to indicate the number of weeks of gestation for today. Alright, so again, in some ICD-10 questions about pregnancy, you can go and find your Z3A codes. Sometimes you can eliminate a lot of choices, okay, by just checking your Z3A code, which indicates the number of weeks of gestation. And don't forget, O code should be your priority because it always takes precedence over other codes in the ICD-10-CM guidelines, okay? So in that case, let's eliminate B. Letter D is the final answer for this question, okay? So don't forget the technique that we have used here, so you can safely do the elimination technique here. All right, a little bit of the same with your surgical or the surgical procedures in the CPT coding. All right, for chapter for your female reproductive system chapter. Okay, so let's now proceed to the next case. Okay, so let's now proceed to your second case study question here. So this question is about integumentary system, okay? So if you will check the question asked here, what's the CPT code for this scenario? So that's the one we're looking for in this case. So Justin Bieber, not the artist, not the singer, okay, went to the hospital, all right, because he's concerned about the diagnosed squamous cell carcinoma. All right, this should be C, carcinoma on his scalp, okay? So again, the site is very important when determining questions, okay, in your integumentary system, okay. Additionally, the patient also has another lesion on his forehead. So you have a cancer or a malignant lesion on the scalp, and also another lesion, it's not mentioned if it's benign or malignant yet, on his forehead, okay. So let's check what happened, what was done to those lesions. So you have first the carcinoma of the scalp. The doctor excised that lesion, all right. So the measurement is mentioned here as 2.3 cm, okay. So again, if an excision will be done or repair will be done for your integumentary system CPT coding, please take note that you have to check the measurement, okay? It's very important. It will give you a huge advantage in checking the choices and of course your codes, okay? Let's also check the other procedure here with extensive undermining, okay? So this word is very important. I will show it to you later, okay? Why? So you have extensive undermining done by the doctor of the wound. I closed it in layers, so the wound measured 4.8 cm. Of course, the doctor will take something out, like an excision will be done for this procedure or for the patient, okay? You have the doctor has to close it afterwards. So usually it will be closed with your repair procedure. So we have different types of repair, okay? But before I go with the types of repair, let's finish the whole scenario here. The doctor then started to check the other lesions on his forehead. So this is the second procedure. This is the third procedure rather, because first procedure, excision of the lesion. Second procedure, repair, all right, of that lesion that was removed. And last but not least, you have lesion here, all right, on his forehead that was what? Done with a 4 mm incisional biopsy. All right, procedure performed, and the size and the sides you all have here, okay? So, and was able to close with 5.0 Surgery Pro. Pathology later showed the squamous cell carcinoma was completely removed, and the biopsy indicated that it's a pre-malignant lesion. All right. So we're looking for 3 procedures here. Okay. You have excision, repair, and also your biopsy procedure. Okay. But let's discuss first what's your repair. So in the integumentary system, one of the major guidelines that you can find there are your types of repair procedures for the skin, okay? If you will go to your 1000 series, specifically your 120 something codes, all right, you have your repair here. So you have 3 types of repair. You have simple, all right, you also have your intermediate, and you also have your complex, okay? All right, let's discuss the difference between the 3. So you have the difference here written in the paragraph information listed in the integumentary system. So if you want to read this, it's completely fine. So simple repair, if a single repair is used by the doctor, or it's mentioned simple 1-layer closure. Intermediate repair is going to be, of course, if the doctor will be doing layered closure of 1 or more deeper layers of the subcutaneous tissue, etc. Okay, so just read this one. So you have to check these keywords right here. So if it's going to be 1 or more deeper layers of the skin that will be repaired, then it's going to be intermediate. And also, if it's mentioned here that the doctor will do a single layer closure of what? Heavily contaminated wounds. Okay, you will go with your intermediate repair as well. All right. And for your complex repair, either it will be mentioned complex repair is done by the doctor, or you can see it in the following terms. You have your exposure of bone, cartilage, tendon, or named neurovascular structure, debridement of wound edges. Most importantly, this one, extensive undermining. So extensive undermining, the reason why I highlighted this one, because we can find it in the actual scenario. It's here, extensive undermining. So that's going to be your keyword to determine that this is a complex repair that was done. Okay, so you may want to use this paragraph right here as your main information if you want to differentiate the 3 of them. Okay, but it's very easy to do, so just try to review this one if you have time, or maybe you have done reviewing this one as well. All right, so we have to check now your CPT codes from your choices. So first code here shows 13132, 21, and also 12032. Let's find out what's your 12032 first, okay? Because the 3 are kind of, you know, they're very near to each other, okay? So go to 12032 first. Your 12032 is your intermediate repair. So ask yourself first, am I going to code this? Because according to these choices, according to the scenario rather, extensive undermining was done, okay? So this one is questionable, but yeah, let's park this one for now. Let's put a question mark. Let's check your A, C, and D if it's better to be coded than letter B. Okay, 13132. Your 13132 is your repair, complex repair of the body part. So again, these are the sites, so you can just compare the scenario, right? What was repaired. So it's mentioned here: forehead, cheeks, chin, mouth, neck, etc. Okay, so we're looking for repair here of what? Scalp, because that is where the lesion was excised. Okay, so can we find scalp here? Maybe forehead, but let's check 13121. Maybe the word scalp is there, so you have it here. Scalp, complex repair. So this is much better to use. So we can safely eliminate letter A in this case. We can also eliminate B because letter C and D looks more promising because of the term extensive undermining here, which is for your complex repair. Now, of course, we will check the second code here, which is your 11623. So again, there's a technique here, guys. If you see a code starts from 114, high chance that it's your excision of benign lesion. Okay, non-cancerous lesions. 116, if your code starts with 116, high chance that it's excision of malignant lesions. So we're looking for an excision of malignant lesion here for your 116 code. Let's check. And take note, guys, that since excision codes, you might say that excision codes already includes repair. It only includes your simple repair. So you still need to code other types of repair other than simple repair. All right, because here complex repair was done. Okay, so you have 11623. Okay, so that's excised diameter of 2.1 to 3.0. So you have excision of malignant lesion of what? Scalp. Very important to check the site, all right, and the size. All right, so you have the size here, 11623, 2.1 to 3.0. It's mentioned here 2.3. So you can choose 11623. Okay, so the main problem here are your last codes. Okay, 11440 and 11106. Okay, 11440, let's find out. So this is for the other procedure that was done for the forehead, which is incisional biopsy. And 11440 is your excision of other benign lesion. Okay, so it's mentioned right here where? Forehead. So you can see face here, all right, which forehead is also located. So, but this is not the one we're looking for since that lesion was not excised. The doctor only did incisional biopsy, okay, of that particular lesion. Let's check 11106 then. Your 11106 is going to be one of the types of biopsy here. You have your tangential punch and incisional. Okay, since biopsy is only done and not the entire lesion was removed, we won't be coding the excision. Only incisional biopsy was done for this case. Okay, so we will choose letter delta here as your final answer. So again, the lesson learned here is, of course, you have to check if it's a multiple coding, multiple codes or multiple CPT codes that you will apply for a certain scenario like this. Please be careful of coding a lot of them, because sometimes, let's say for example, simple repair is already included with your excision code, so please be careful. But in this case, since complex repair was done, you can code them in conjunction with your excision code. And that is how you will be answering some of the case study questions. And since we don't have that much time, all right, to answer a few more cases, I highly suggest, okay, you can try to purchase the AAPC practice exams. You will see a lot of this, okay, these cases in the practice questions that they offer. Okay, I will list the website. Okay, I will paste down the link. Okay, so in the description below, so later on you can check it. Okay, if you want more of this, you can check that one. And I want you, of course, to succeed in the upcoming CPC exam, which of course some cases are there which is which are sometimes very lengthy, but you can answer these questions. Okay, so I will be posting more case study questions in the future. All right, so just comment down below whatever you want, whatever topic you want me to publish next time. So I will be continually creating this kind of content just to help you, all right, have knowledge about this particular cases. And I'm always grateful to share my knowledge with you guys, and hope to see you soon, guys. All right, so again, thank you. And if you have some time, you can also subscribe. You can just click that subscribe button. It will help me a lot. It will inspire me more to create more videos in the future. It's for free, so please hit down the subscribe button, and also hit down the like button for more updates in the future. Again, so long, guys. See you next time. I am the Medical Coding